decided to record this because it's very important when you're checking for your hair transplant physician or your hair transplant surgeon and the team that's going to be doing the hair transplant procedure for you, that you check credentials. Right now, there's a lot of people coming into our field without adequate training, and we're seeing, unfortunately, a lot of complications that we didn't see before when hair transplant surgery was more in the hands of only qualified physicians. Nowadays, there's even people that are not even doctors or PAs or nurse practitioners, which by law can do it. We're seeing surgeries done by technicians that are non-licensed. So not only that breaks the law on most states, but also it's unethical. I really believe that the responsibility of the procedure, the responsibility of the design of the surgery, the planning, and all your results should be in the hands of a qualified doctor or a nurse practitioner or a physician's assistant under the direction of their physicians. So make sure you check that. So I'm going to show you just a few things that are important that you need to check and why it's important to understand hair and be in the hands of someone qualified. So talking about the importance of understanding and having someone that understands hair, understands what they're going to do for you. Every hair that we put on the head or anywhere else in the body, the beard, the eyebrows, it has to have a purpose. It's just not putting a hair willy-nilly and expect it to grow and look cosmetically acceptable. There's a lot of details that go into this. Hair transplant surgery is one of the most complex procedures. I know this because I teach doctors all the time. I've taught hundreds of doctors over the years on this, and some have more of a natural talent for this because it involves a little bit of an artistic view of the procedure, not just the technical aspects, which obviously are important, but the physician has to have an artistic view to visualize results a year before they happen. So why is that important? I just brought some pictures here to show you, just to highlight some of these things. Looking at this patient's scalp here is one of our patients that was gracious enough to allow me to use the pictures. You can see how the hair is shaved, right? There's some loss here in the front. This is the left side of the scalp. If I blow this up here, and if you pay attention to the hair direction, you can see how these hairs here, I don't know how the camera can show, what the camera can show, but these hairs are more of a forward and up direction towards the front. Right here, there's a transition zone where you come from this to this, and then to this, and then to that, right? You can see here how the angle is much lower. So when you place the hairs, when you transplant, if I'm transplanting this patient, which I have, by the way, I have to take that into account because if I don't follow the natural distribution of his hair, I'm not going to create a natural result for him, no matter how good a job I do, right? So if I go here on his other picture, bear with me for a second. So that's his right side. Same thing, you see hairs growing this way, and then here they start to turn. So there's a transition of the hair direction and the hair angle. So that's very important. It's critical for natural results in transplantation. Not everybody understands that, and it's very difficult to recreate if you don't know what you're talking about. Another critical area is the crown or the vertex area. So here you can see, for example, this patient, right? You see how everyone has that whirl or that little cowlick on the back of their head? We'll talk about that in another video, why that is that we have that. It's actually a pretty cool thing, but regardless, for this purpose of this here, you can see how the hair here goes into a kind of a fanning motion. It kind of rounds around this area here. So if I'm recreating that crown, I need to follow those hairs. If I don't, then it's not going to look natural, and you can have a transplant that doesn't allow you to style the hair the way that you want. So did I get like that understanding overnight? It took me years to get it. I've been doing this for over 20 years. So same thing, it takes time. You're looking for someone, look for someone with credentials in hair. Women's hair loss the same way. Their hair varies in their scalp, and not everybody's the same. So the doctor you choose with experience, he'll learn how to look for these things. So make sure you choose wisely. Why it's so important to consult and to have your procedures done with someone who really has a passion for this, understands the minutiae of hair growth and hair loss and how to create the results that you and your scalp needs. Not every patient is the same, everybody's different. So as we explained before, it's important to have an understanding. You're not going to see results up until a year from the procedure, so mistakes can show up later when it's too late. So make sure you check credentials in hair restoration surgery, not just credentials in plastic surgery or urology or whatever else, but in hair transplant surgery. So if I can be of any help, feel free to contact me. Thank you.